Hello everyone. My name is Safdar and I am a pulmonary and critical care fellow at the University of Alabama at Birmingham. Today I will be talking about the diagnosis of tuberculosis. Let's begin by talking about who should get tested for TB. You should talk to your doctor or talk to the Alabama Department of Public Health if you have been in close contact with someone who has TB, have a history of HIV/AIDS and a weakened immune system, you were born in or lived in a country where TB is a common disease and have symptoms of cough greater than 3 weeks, fever, night sweats, and unintentional weight loss. Testing is also recommended for people who are at high risk of developing TB, for example, healthcare workers, nursing home residents, correctional facility staff and residents, hospital employees, unhoused individuals, and people living in crowded living situations, and people with diabetes or those who use IV drugs. The diagnosis of TB is multifold. Firstly, you can get imaging of the chest by getting an X-ray. You can get some blood samples and look for the presence of tuberculosis in that way. Or you can also take mucus samples and look at them under the microscope or try to grow them out on a culture. What I want you to remember from this is that the culture can take 4 to 6 weeks to give us an answer on whether or not the patient has tuberculosis. Let's start by talking about TB skin testing. Basically, a small amount of fluid that has sterilized protein from the bacteria in it is injected under the skin of your forearm. It doesn't hurt much, and you go home after the injection is done. 48 to 72 hours later, you will come back to the health department and the nurse will measure a bump if it develops at the site where the injection was done. The size of the bump, depending on your risk factors, tells us whether or not the test is positive or not, and then we will talk about what happens from the positive test. Like I said, the test doesn't hurt much and it is completely free at the county health department. I have left the information on what the different sizes mean here for your reference. Alternatively, we have the option of getting TB blood testing. A simple blood draw is done and the blood from the patient is mixed with TB proteins, and if this patient has been exposed to tuberculosis, the blood cells will have a reaction to the TB proteins and we'll be able to measure this reaction. The results come out in 1 to 2 days and we're accordingly able to process the results. If it's positive, it's likely to be a TB infection. If it's negative, TB is to be unlikely, and unclear, we'll talk about what we do then. This test is particularly useful in people who've had the BCG vaccine, which is quite common in many countries around the world. So now putting the information together. If a person has tuberculosis risk factors or the symptoms that we talked about, we choose a test, whether the skin test or the blood test, and then we process the results. If the results are positive, then it's likely to be TB and we proceed with the chest X-ray and sputum cultures or the mucus. If it's unclear, we switch the test around or can also proceed with imaging as well as getting the mucus sample. But if it is negative, then it is unlikely to be TB and it helps us rule out the TB infection. Okay. So now the blood test or the skin test is positive. What happens next? So firstly, we get a chest X-ray. This is to look for signs of TB on the lungs. Secondly, we also look at mucus samples. We need 3 consecutive mucus samples taken on 3 consecutive mornings. And the lab basically looks at the sputum for bacteria. Like I said, the cultures take 4 to 6 weeks to finalize and gives us the final answer of whether or not TB is on there. And then we can also see what medicines will work best for that particular bacteria. Now, putting all of the information together, if you have a positive test but a normal chest X-ray, then this points towards latent TB, which is silent TB infection without active disease. Now, if the chest X-ray is abnormal, then we call it active TB and immediately the patient starts on treatment. Throughout this whole process, the Alabama Department of Public Health is tracking the patients who have positive results and providing guidance on how to manage them. To summarize, TB is tested with a skin test or a blood test. Both of them are accurate. A positive test doesn't necessarily mean you have TB. It's the first step in our diagnostic algorithm. Once we get a positive test, we go ahead with the chest X-ray, mucus sampling, diagnose, and then go ahead with treatment with the Alabama Department of Public Health. Nobody needs insurance for TB to be diagnosed or managed. This is free. There's free treatment and diagnosis available at all 67 Alabama County Health Departments, and all of this is confidential with a confidential helpline that you can call at any time for support. And latent TB can be treated to reduce your risk of developing active TB. These are my references. And finally, I want to leave everyone with the message that everyone who has any concerns for TB should get tested, free, confidential, as soon as possible. And I've left the information for the TB hotline on this site. Thank you so much for listening. I'm looking forward to seeing what everybody else has to say about TB. Thank you.